Good afternoon. I'm Harriet Flowers, and I want to tell you a short but personal story about opportunity lost for myself. And to do that, I'm going to back up 8 years. In the late 2007, I had just retired at that time as the Welsh Carson revenue cycle company that I founded in the 90s was merging with MedAssets. I was asked to look at a company called LingoLogix, which was making a very bold claim that it could fully automate with no hands the conversion of a free text physician's note for an office visit into a billable code. For myself, the best way to evaluate any company is to observe the sales process with a live potential client and just see how the look on their face, how well does the product actually relate to the potential client. So I had a friend who was a practice manager for a large physician group, and he listened to the pitch for this company, and at the end of it, he was intrigued, but like me, he was a little bit suspicious that you could really codify the type of really intricate logic necessary to convert that free-form human note into a billable code for the office visits. So he reached out into the hallway and grabbed a physician that happened to be going by, and that physician had just typed in a note for an office visit that morning, and he had given that note a preliminary billing code. So within a couple of minutes, the physician had cut and pasted that text note into the system, and seconds later, it came back with the billing code. Well, the only way I know to really do a good technology solution is that the end user really goes completely past the technology to the business problem at hand and starts to relate with it. And that's exactly what happened in this case. The physician immediately started talking about, well, you know, I had thought about that, and I see how they did this, and I considered that when I did this billing code. And he said, you know what, I think I probably undercoded that. And so I thought to myself, wow, we have a good system here. This is great. Now, unfortunately for me, 3 weeks later, that company was acquired by Cerner. So I didn't get to participate at that point. But let's fast forward just a few months ago. Rhonda, the founder of that company, LingoLogix, approached me with an idea to start a new company using the latest and greatest natural language processing technology in combination with a very innovative approach to the market. So this time I said, I'm in. I jumped on it, and so I'm very excited about it. And so today I want to introduce you to Rhonda Thomas-Florimbi and have her give you the opportunity to hear what a great idea she has.
Good afternoon. My name is Rhonda Thomas-Florimbi, and I appreciate Harriet giving you such a great background story on our company. Codedgi is automating the last manual process in digital healthcare records. This has been a time-consuming and often human process. So why am I here? Well, actually, I've been working in the natural language processing area for about 15 years. So I started out finding out about this technology when I was a subject matter expert working at KPMG and Deloitte Consulting. I thought it was fascinating that you could teach a computer to read text. I mean, think of all the things you could do with it. We looked at some of the different business cases in healthcare and thought, wow, as soon as electronic medical records really take hold, this is going to be the next best thing. So I left consulting and started a company, LingoLogix. We developed the first auto-coding solution for healthcare records. with free text. The company was sold to Cerner in 2008. I went on to become a speaker as well as a consultant to other companies that had acquired natural language processing technology to help consult with them as to how to deploy this in their various solutions. But through this, I also was able to identify new opportunities in the market that nobody was going after. So as Harriet told you, I quickly put together a business plan and started calling up people to say, hey, the time is now. We need to jump back into this because there's tremendous market opportunity. So for some of you that maybe not be healthcare related, you're just a patient and you know you pay your insurance company and then you can go see your doctor, but you don't really see how that doctor gets paid. So the doctor, when he sees you, creates a note, a documentation of your visit, and then humans have to come in, read the note, and try to figure out what the proper codes are that the insurance company will accept so the doctor can get reimbursed. Unfortunately, since we have humans picking these codes, once they're audited after the doctor's been paid, we often find out that, gee, gosh, we left money on the table because we didn't get the codes quite right. So the doctor was often underpaid. With Codedgi, our automated solution, we have demonstrated that we can provide automated coding at a superior accuracy level of 95%. So, would you rather have 95% accuracy or 65% accuracy? Automated coding generates much more consistent, higher accuracy than the human coding, which is really obsolete. At Johns Hopkins, we demonstrated this with LinguaLogix. Our system was in production for over 8 years, consistently coding correctly against audit. Some additional benefits we discovered was all of these coding systems, the complexity of them are very, very difficult and complex. They've just gotten more complex with the introduction of ICD-10 just this first part of October. We were able to demonstrate huge improvements of productivity, higher reimbursement for the organization, better accuracy, speeds, and important insights for compliance. So this is what a note looks like. It's just a blob. This is what your doctor generates after he sees you. And you think, I'm going to have a human actually read this and figure out what the proper codes are. But with natural language processing, the magic is the computer is going to do the work. So the computer reads through, understands the semantics and the different dialects and vocabulary, and can actually mark up the text. And then we match it up with our understanding of what we're looking for in different sections of the note. And then we use algorithms and other means to add up the different rules and come up with the proper code based upon the content of the note. So are there competitors? Yes, there are competitors. And many of these competitors are big companies like 3M and Nuance that acquired other small natural language processing companies such as myself, first generation. But they've turned their focus to acute care, working in the hospital space. And they're still using the assisted coding product where humans still have to interact with the system. They're also providing diagnostic codes, but not so much the professional fee codes that the doctors need to get reimbursed. So we're focused on a different area. We're focused on the outpatient and the provider clinics. We provide automatic coding. We work with auditors so that we make sure our precision is correct. And not only are we doing the diagnostic ICD-10 codes, but we're also doing the professional fee codes and others. So this is a huge market opportunity, 3.5 targeted market opportunity. Initially, we're focusing on working with compliance and auditing companies with a cloud-based SaaS-type model, and we're able to charge $5 to $7 a note. Now, you might think, wow, that's a lot of money to read through a note. But the human auditors are currently charging the doctors $25 to $75 a note. And we've already discussed how accurate that is. So our benefit is we're able to offer greater accuracy, huge improvements in productivity, and lower cost. Likely exits are to revenue cycle management companies, enterprise health record companies, as well as insurance companies. We're forecasting $3.1 million revenue in 3 years. Although we're currently pre-revenue, our revenue will begin with our beta sites. We have prospected and identified potential beta sites, one with Tenet in their imaging center down in San Antonio. Healthcare Resource Group has already signed to be AA for testing, and Compliance Consortium Network has signed a letter of intent, plus others. Investment fundraising, we need to complete our beta site evaluations and provide new insights into further development. We're seeking $600,000 for our first round to get our minimum viable product and 3 betas completed, and $2.1 million to expand our marketing, so a total capital of $2.7 million over 2 years. We have a fabulous team. Jan Clark is our compliance officer. She worked with me at LingoLogix. She's done several startups, so in the healthcare IT space. Harriet Flowers, you just met. We're so happy to have her on board. Not only does she have revenue cycle management experience, but NLP software development. So we're automating healthcare records. Come see me if you'd like to learn some more, and thank you for your time.